Welcome to another episode of Weight Loss with Dr. A.
Hello everyone, and welcome to another episode of Weight Loss with Dr. A. On this episode, I want to address, actually, part of my team has been getting a lot of questions regarding mainly PCOS, which is polycystic ovarian syndrome, but also diabetes in relationship to weight loss surgery, but also with high blood pressure and sleep apnea. So if you didn't know this, because my team didn't, I actually told them, well, we can talk about metabolic syndrome. And this syndrome actually globalizes all these situations: PCOS, high blood pressure, diabetes, cholesterol, triglycerides, all these issues that are weight related, and when some of these are present, it's called metabolic syndrome. The idea came with PCOS, and polycystic ovarian syndrome is a situation where we get a lot of patients coming in from the OBGYNs. We get a lot of patients that are referred to us by OBGYNs because they've tried quite a bit dealing with patients with polycystic ovarian syndrome, and they get to a point they get tired. They get tired, the patient gets tired, and they really don't see a good result. PCOS is a major cause of infertility. It's a major cause of menstrual cycle irregularities, and it's also a cause of a little bit of facial hair, hirsutism, hair in undesired parts, and so on and so forth. But also PCOS has, since it's related to metabolic syndrome, it also is related to insulin resistance, and practically half of the patients that have PCOS, if not treated, and if you let it progress, half of the patients will develop diabetes by the age of 50. So it's a struggle. It's a struggle. Now, before weight loss surgery and its massive effect on PCOS, OBGYNs and doctors would treat this mainly with metformin, and this medication would help lower the insulin resistance and would help, in theory, the PCOS. It does help it, but the effect of the metformin on this medical situation, on the PCOS, is only so much in comparison with the big effect of weight loss surgery toward the metabolic syndrome. Why? Well, the thing is, once you decide to have weight loss surgery, and once you get on board, and once you get losing a whole bunch of pounds, everything starts to get better, including hormones, all right, which is very important on the PCOS. Once you start losing a lot of mass, a lot of weight, hormones start to get into tune. Actually, I love when patients get pregnant and they've tried for years, and they're dealing with PCOS. They've tried several fertility treatments with no luck because the metabolic syndrome is not helping them. So I tell them, you know what, when you decide to have weight loss surgery, you got to be very careful not to get pregnant at least the first 12, 18 months down the road. Oh no, doctor, I've never gotten pregnant. I've tried so much. I've done this and that, and they don't hear me. They just take it in vain, and here they come 3 or 4 months after, knocking on the door saying, doctor, you know what, guess what, I'm pregnant, now what? I'm 3 or 4 months out of surgery, having a surgery that's designed to take you down and take you down on the weight and just get you in the fat burning stage, you know, but at the same time you're pregnant in a stage where you're trying to get to a certain weight and form this new being, you know? So it's not an ideal point in your life where you want to get pregnant. And I tell these tips to the patients, and this him and her, you guys got to be very careful for the next 12, 18 months not to get pregnant. Take your precautions. Listen to me, because it's not a good situation. It's happened before, yes, and if it happens, we've got to be more aggressive, and we got to be more aggressive with the vitamins and supplements, and work together with the OBGYN and their supplements. But it's not an ideal situation. You got to understand this. So, does the PCOS get better after weight loss surgery? Most definitely. A very vast majority of the patients, big percentage of the patients, get so much better with the PCOS. That's why we get a lot of patients referred to us because of this situation, and it does get better. Be careful, because fertility sky rises after weight loss surgery. You don't have to have PCOS, but everything gets better into tune with the hormones. So be careful. Menstrual cycle gets better. Patients who have anovulatory cycles, that means you don't the ovaries are not ovulating. Everything gets better because of the hormones start getting into tune. So that's one aspect. PCOS, does it get better? Definitely. The effect, as I was telling you, the effect of the metformin is only so much compared to the surgery, which is greater. So it really is a big blessing, and it's a very happy scenario when a couple come to you practically in tears, telling you the news down the road that they have been able to conceive, and due to their weight loss, everything got better, including their fertility, and now they're going to be parents. It's just a blessing. It's such a great news, and the way you can tell how they transmit this joy. So it does get way better. The other situation I wanted to talk about, the metabolic syndrome, is triglycerides, cholesterol, diabetes, and high blood pressure. These situations, once you go into massive weight loss, once you get going once you're on the train and losing weight the way you should, everything starts to get better. I just want to make sure you understand that there are some headlines that you may see online, or groups, or even media, good media sources, that they say they cure diabetes, where the term cure isn't correct, because you don't cure the situation. Let me tell you why. You are making it go under remission. It's like cancer, all right? Once you have cancer, cancer goes into remission, and you got to get screened sooner or later down the road just to make sure it's not reactivated. Same thing goes for diabetes. When you lose substantial amount of weight, your body functions better, as the hormones we were talking a few minutes ago. The diabetes gets so much better, insulin works so much better, your muscles work so much better toward insulin, and your pancreas works better. Everything gets better. Your tissues work better. So if you get some blood drawn in these patients down the road, you may notice that there is no sign of high glucose levels. There's no sign of diabetes. But you used to have these high levels. So you were diabetic, but you still are. It just went under remission. Makes sense? These situations are well known. We want to call it correctly. We got to give it a name correctly, which is called going in under remission. And we also know high blood pressure is another situation that gets way better once we start losing a substantial amount of weight. And the other one, which is one of my favorite, which is sleep apnea. So if you're one of these patients that snores, which about 80% of my patients snore, 8 out of 10 snore. That means a very high percentage of these patients have sleep apnea, this condition that you stop breathing for a very short period of seconds while you're sleeping, and it wakes you up. It kind of wakes you up really small you wake up a very small period of time and you fall asleep. You are not conscious enough to actually notice this, and what that happens is that you will be tired throughout the day. Patients are sleepy, patients are not well rested, patients have a continuous fatigue, chronic fatigue, and your outcome throughout the day is not good. Patients in more severe stages may even fall asleep behind a wheel, may fall asleep even in the restroom, sitting down. All right, I've had these situations with former patients, may fall asleep watching some TV on the couch or even on the dinner table. If the subject, if they're talking about something that's not that attractive, they may fall asleep right there. So these situations, of course, there are certain grades, and some are more severe than others. Most of the patients don't even know they have sleep apnea. But coming down to the subject related to weight loss surgery, it does get better. And this is one situation that's really, really cool because the patient gets better, the patient feels better, their energy is so much better throughout the day because now they're getting a good night's sleep, they're resting, they really are resting. And the most important thing is their family member, their spouse, thanks you for them because they stop snoring. Okay, so a lot of these patients also have had a throat surgery trying to correct the airway with ENT specialists, trying to correct the airway to get better. But most of the cases, it's just a situation where they get kind of better, but it doesn't cure the essence of this issue, which is being overweight. So weight loss surgery attacks these issues very nicely, which is the metabolic syndrome, talking about high blood pressure, sleep apnea. We talked about insulin resistance. We talked about PCOS, triglycerides, cholesterol, so on and so forth. There's a big, big list of situations that get so much better. Venous insufficiency, restless leg syndrome, migraines. All these issues get better. But in this episode, I really wanted to focus on the metabolic syndrome. So now you have it, you have this information, you want to know more, you can sure Google metabolic syndrome and weight loss surgery. I just want to give you the highlights of the situation regarding weight loss surgery and getting better on this particular metabolic syndrome. You can always contact me, my staff. You know where to reach us, Endobariatric. Search for Endobariatric. It'll take you all over our social media platforms and my website. And if you want to contact me directly, best way is through my personal Instagram account. So I'm Dr. Alvarez with Endobariatric.com. I hope this was helpful. We change lives one sleeve at a time. Take care and God bless. Bye-bye.
If you're interested in knowing more about the gastric sleeve, visit Endobariatric.com.